so we're going to do the posterior view now to see how his body is aligned from working hard. So we're going to start at the bottom, work our way up. First we're going to look at is the Achilles tendon to see if they're straight, the dots line up. As you can see, he rolls in, which means the arches of his feet do too. Both sides are the same. Then we work our way up to the creases in his knees. So we can see they don't line up. One is lower than the other, which could be from all up in the hips. So then Alright, so now we're going to look at the upper region of the posterior view from his upper cervical to his mid-lumbar. All of them should line up nice and straight, but as you can see, they start to curve as you get to the top. Next thing we'll be looking at is these two PSIS dots. They should line up, but as you can see, one side is higher, which is the same as his knees up to his pelvis, so it all counteracts one another. Then we're going to look at the distance from these two to this two to see if his shoulders are rounding. As you can see, this side is wider, so this shoulder is curving in more, which is his dominant side anyway, so he uses that more. As we go up, as I've said, you can see it's curving. So his shoulder placement is in. Ear height, we can see they're pretty level, although it's starting to tilt from one to another, which is straight, all lining up together. So then we can check the gaps between, put your arms down straight, between his arms and his body as well. We can see that this side is slightly wider than this one as well. So it's all curving, therefore he gets more of a gap in between here. His head placement is pretty perfect. Despite being curved, it is still to the side, but it's not as bad as it could be. So he's got an internal rotation of his shoulders. Alright, so now we're going to do the anterior view, which is the front. We'll start from the bottom once again, always working our way up. We'll see the feet, the arches to start with, as he rolls in, feet, ankles, and then four coming together. Working our way up, we'll see if the knees are bowed or locked out. If they're knocked out, they come together, okay? As you can see, they're both pretty normal. This one is slightly a bit more. Therefore, that shows why the dots are also uneven on the top of his kneecaps. His kneecaps do not align. So we can see with the second metatarsal, this one is slightly more in than this one is. Then we go up to the hip. So we're checking the pelvis aces, which is these two dots here, to see if they are aligned. But going from the back view, we already know that they shouldn't be aligned due to that one not being aligned to there. Then we go up and we want to check the clavicles, distance from one to another. As you can see, pretty central, nothing too bad. So we don't want one closer than the other. Then we want to see if the neck is coming across, which you can see it's slightly going to one side, which once again was already shown to us in the back position. Also, we want to check if the clavicles are at different angles, which once again, with the shoulders rounding, being uneven at the back, this clavicle is more on an angle than this one. His head height tilts down as well, making his ear height slightly angled. Alrighty, so now we're doing the side views. So we're starting at the feet. We're seeing if the fibula is posterior to the knee joint. So from the bottom up, if it's middle of the graded trachnata, and then to the lumbar spine, which all the way up to the dimples in the legs, which are around this area. So then with the verbal body, which is all the way up to here, we want to acronym process, so that's on the shoulder. We want to make sure that it's all level with the ear. So what we're going to do, we're going to check the imbalance of the foot to see where the weight distributes in. As we saw from before, it already tilts in from into the center with the other views already. We want to make sure it's even placement, which obviously it is, but it's tilted in. So as we can see, slide that arm backwards, the hips are anteriorly rotated as it's coming towards the front, with this dot being all the way around here. So then we've got the vertebral columns going forwards, scoliosis all the way up, okay? So that's the curve, all the way to the kyphosis, and so on. We've got a rotation of the shoulder, which we've already found out through the other angles of the view, of the postural views. So as we can see, it comes forwards with this dot not being in the center. It's all rotating, which could be from the postural imbalance of the pectoral muscles, pulling it all through nice and tight. So to fix that, we want to stretch up against the wall, pulling it back to make it nice and loose again. Therefore, the shoulder position is forwards, making the head carried forwards as well. Alrighty, so now we're viewing the last side to get the differences from one side to another. So if one side was rolled forward in the shoulders, this side is going to be 2 as it all counteracts. But as we showed in the front view, it's not as much as the clavicle is further away from the shoulder, making it not as rounded, still tight pectoral muscles, making the imbalance in it. Starting from the bottom, once again, feet are rolled in, line from the knee down to the first metatarsal is once again slightly inwards. Working our way up all the way here, still once again, not a straight line, feet, knees coming forwards, locking out there. Going all the way up once again, shoulders forwards, which is also carrying the head forwards with a pelvic tilt. Yep. So now that we've done your analysis of your injury, I know all about it, and we've done your postural assessment, we're going to go through some range of movements to see about your shoulder injury. So I want you to go forwards, up to the sky, back down. That's it. Now out to the side, all the way up. Back down. I want you to stop halfway. Bring your hands in. That's it. While they're there, out to the front, back out to the front, up to the top now. Back down. Alright, arms down. Arms out and across the front, all the way around. That's it. Back down, other side. Back down and then shoulder shrug all the way up. So that side's a bit higher, yep, that's alright, that's what we've shown in our postural assessment as well, so back down. So we can see that your bad shoulder doesn't have as much range of movement as the other one. Alright?
Is there anything I can do to help rehabilitation for my shoulder?
Yes, certainly. So you can do the stretches that we showed earlier in the other postural assessment videos, plus you can do resistance bands exercises, so holding it here, out to the side, do the raises, exactly what we just did, but with a resistance band, slightly adding the resistance in the bands.